Good afternoon, everybody across Long Beach. It's our briefing for October 22nd. And as always, después de que haya preguntas, también vamos a tener uno resumen en español también. And so thank you all for watching. We're going to be joined by Sandy Wedgeworth today from our Public Health Emergency Program. Obviously, a critical piece of all of our response to COVID-19, and Sandy is here to give an update, but also to answer any questions as it relates more broadly around COVID, if there are any questions today. Overall, there's been about 12,870 residents have tested positive for COVID, and we always review that number. And we've now up to 255 residents that have lost their lives. We mourn every single one of those in this city. And that number is expected to continue as this pandemic moves forward, which is it's just really, really sad for all of us. And our thoughts and our prayers of love go out to all those families. So I want to go over a little bit of an overall update. We, early on in this health crisis, of course, we have done these updates pretty consistently, have answered, of course, as many questions as possible, and have provided information to all of you. We are now continuing to do these as needed to ensure that we kind of capture what's happening at this moment. And I want to give everyone a little bit of a broad overview of where we are, and then go over some data, and then I'm going to turn it over to Sandy. So hopefully we can get through all of that. I want to just first say, broadly speaking, I think everyone is probably reading what's happening right now across the country as it relates to COVID-19. The truth is that we have 22, 23 states, and that number changes day to day, where cases are continuing to increase, and in some cases, dramatically. We have some states that are seeing their highest positivity rates that they've ever seen, or in some cases that they haven't seen since the height of a few months ago. And so what's happening around COVID-19 across the country remains really serious. Now, back here in California, we're seeing the opposite happen. I think thanks to leadership of our governor, of all of our regional partners, and certainly our health department here locally and departments across the state. What you're seeing in California is a continuing, a flattening, and in most cases, a decrease in the positivity rate, as well as transmission and community transmission that is happening. And so while California continues to really show progress, we can't say the rest for the same. We can't say the same for the rest of the country, and that is problematic to us here locally, because what happens in other states will impact us and vice versa, particularly as more folks are traveling in between locations. I often see on in emails that folks might send or messages that people send. We're doing better. Why don't we reopen more? The truth is we're doing better because we are limited in what is actually open. So if we just reopened everything tomorrow, and if the state made that decision, what's happening in other places across the country, like Wisconsin and other places, would be happening here. So let's just be very clear that our positivity rate and community transmission is low because we are being cautious and slow and steady. And so when folks say, open up this, immediately, this should be open, we're doing so well, that's just not the way it works. We have to continue this pattern of steady process so that we can have more reopenings, which we're going to get to in just a minute. And so we've been able to continue to reopen industries, and we'll continue to be able to do so as long as we remain responsible and slow and steady. I know that's not acceptable to everybody, but that's what we're gonna do. Want to also just note that on the testing front, we should be so really proud of our teams. We've conducted over 240,000 tests, both in our public labs and our private partners. That means that in Long Beach, we are testing at our capacity. We continue to have room at our testing sites day to day. We are seeing more and more interest but from new folks getting tests. We have some folks that have now come to our testing sites multiple times, but we want people to get tested, particularly if they have symptoms. Our testing capacity in Long Beach is twice the state requirement and ask of us. And so we're really leading from a city perspective our testing capacity. I'm really proud of our testing team, so thank you. And in fact, you're going to hear from Sandy, and Sandy's obviously leads us on those efforts and is involved in all that front, so thank you to her and the team. Also want to add a little bit on vaccinations and the vaccine process that the governor and others are talking about. We know that, first of all, there is no vaccine that's going to be available to the public in the course of the next few weeks or months. There is no approved FDA vaccine. It will likely be sometime in 2021 where there will be a vaccine. I said likely because that's what we're hearing, at least from Dr. Fauci and some of the experts. But please remember that when we get to that point when there is a vaccine, there will also be a complex process that we're going to have to go through and how that gets implemented. And I want to just make sure people know that in Long Beach, we're already having meetings and discussions on how the vaccine, once approved and once verified by the state, will be distributed. You can imagine we've learned a lot from our testing sites, and we are already working on that. And so just please rest assured that your team is already working on how we would distribute vaccines, hopefully sometime next year, and how we do it safely and in a way that's equitable across the whole city. I want to talk about some of what's happening with our statewide indicators. So as you probably know, if you look at this first graph, the state has its new blueprint for a safer economy. And this week, LA County, which includes Long Beach and Pasadena, remains in the purple tier. We remember the purple is the most strict tier, then red, and then goes down to orange. And then I believe it's yellow right after that. And we remain in the purple tier. Our adjusted case rate is 7.6 per 100,000. Our positivity rate is 3.4%, which is actually some of the lowest it's been. We have been hovering right around a little above 3, a little below 3, and that's really great news. So the positivity rate remains low. The case rate we still need to get lower. And so this puts us in the overall purple tier. We remain in the most widespread tier. But we are, I would say, on the verge of going into the red tier in the course of the next couple of weeks if we continue what we're doing. And so we've got to wait and see. On Tuesday, the state announced that some additional business sectors would be allowable in the purple tier. This includes nail salons, personal care and beauty, esthetician work. Many of those functions could move indoors with, of course, some limitations and some rules, just like we've done for barbershops and hair salons. And so please know that tomorrow, the Long Beach Health Department will be putting out its revised health order to incorporate the ability for nail salons, beauty, personal care services to transition and begin going back into service indoors. Many of them are already outdoors in the city, so that announcement will be tomorrow. And then I want to transition you to this next graph, which is our case rate in Long Beach and LA County. I want to show you this especially because I oftentimes hear, well, we have our own health department. Why are we being counted with LA County? The state counts us per county. But even look at the October 20th date. While there are some variations, our case rate is the same as LA County. So even if we were being counted separately, it doesn't change what we can or can't open. The city of Long Beach, along with LA County, has essentially opened everything that we are allowed to open within the purple tier. And so that's where we're at. Our numbers are no better than the whole county as of today. And those numbers vary, day to day, but not much of a difference. And then if you look at the positivity slide, again, it shows Long Beach and LA County. We are doing a little better today. But if you just go back, a couple of weeks, we weren't doing as well. And so that, again, has fluctuated, but not much of a difference. So the positivity rate, both the county and Long Beach are doing much better on positivity than the case rate. And so we hope those will continue to decrease. But our positivity rate here in Long Beach is doing a little better. It's 2.9, even though the county's at 3.4. So good job, Long Beach. Let's keep that up. I want to share now number of new cases by episode date. This is another graph. You really see that curve and that bell curve here in this graph. I mean, I remember when we were, in July and late July, and we were seeing that real spike in cases. You can see that here. And you can see how we've really decreased that curve, and we've got to continue to do that. And so we're looking at this constantly. We all know this gets updated over time, but it's really important. The next slide here is 100,000 cases per resident. It once again shows that our cases, which is the light blue line, continues to be below LA County and the city of Los Angeles, but above the state. And so we're doing a little bit better than the county and LA, but we're still above the state. And so that's something we always look at. And our hospitalizations per 100,000 residents, as you can see. We can see that our hospitalizations have leveled off and are lower than the county's rate per 100,000, which is, again, a good sign for us in general, when we hope to see this decrease as well on active hospitalizations. And so if you look at the next slide, that's image 7. And you can see the overall active hospitalization rate over the last kind of 60 days. While hospitalizations are reported daily, we know that over time, more information is made available that changes sometimes. But we're seeing fewer residents with severe illness that are requiring hospitalization. In May, the median age was 46 that was infected. The median age today is 33. So this whole idea where younger folks aren't getting COVID, I mean, it's really now younger folks that are transmitting the disease more than ever, and 33 being the average. Our look at deaths per 100,000, you can see again, the slide shows our cumulative deaths to COVID-19 per 100,000. Long Beach is in the light blue line, the state of California is in the dark blue line, and the yellow line is LA County. We're obviously still losing lives each and every week, and we're still being impacted. And you can see that in the next slide as well, which is our hospital current utilization graph. We continue to have adequate, stable hospital capacity. Same thing with ventilators. The one thing to note, what we're finding now is our hospitalization rate as it relates to COVID patients is actually not going up. But we are seeing more hospitalizations of non-COVID related, obviously illnesses or surgeries, and that's really because hospitals today more than ever are doing a lot more elective surgeries. Remember, a lot of those were canceled or not allowed early on, and so you're seeing hospitals do more of the kind of work that they were used to, but also still seeing the COVID patients, so that's something to note. But we have plenty of ventilators and hospital beds, and this, by the way, is the number not including our surge capacity. So if we add our surge beds, we'd have a lot more. And then this last graph is our PPE inventory. You can see that we continue to be very well stocked with PPE. And this PPE, of course, provides our first responders, medical personnel, and essential workers all the necessary tools that they need. I want to just continue to ask people, while it's frustrating, I know there's COVID fatigue, COVID is not going away in the next month or 2 or 3 or probably 6 months or more. It's going to be here. It's going to be still causing disruptions. It's going to take people's lives. And so this new normal that we are in, we can expect to be in for many months. And that's going to take us to continue to be responsible and to do the right thing and keep people safe. With that, I'm going to turn this over to Sandy Wedgeworth from our Public Health Emergency Program. She's going to have a great update, and then she'll be around to answer some questions as well.
Okay. Thank you, Mayor Garcia. So I'm just going to show everyone one more graph before we start talking about gatherings today. So this is a graph related to our testing. As the mayor mentioned, we have tested a lot of people. 254 254,275 tests were administered in the city since March of this year, and I apologize for messing up that number. It's a lot. So we're continuing to test 7 days a week. We've also, in addition to our regular test sites, that are operating at Veterans Stadium, at Long Beach PCC, or at Long Beach City College, the PCH campus, and of course Cabrillo on the weekends. We have a site at the Port of Long Beach, and we also have our mobile pop-up sites that are going around the city testing people. So definitely a lot of opportunities for people to get tested. This month, during the month of October, we did see a slight increase in testing compared to September. That being said, our teams are still able to accommodate the need for testing. We haven't seen the long lines that we did over the summer, because we have definitely prepared to be able to accommodate any surges. So any day of the week, there are testing appointments available for COVID testing. And we will continue to find new ways to make testing accessible as the need continues, and to make sure that every single person in Long Beach who needs to get tested will have access to it. All right, and you can find information on our about our testing at the COVID-19 webpage, and that's www.longbeach.gov/COVID-19. Also, just a reminder that for the next several weeks, we will continue to offer flu vaccines free of charge. Those are available on Thursdays from 3 p.m. to 6 p.m., and that's at Veterans Stadium. And also on Saturday mornings at Cabrillo High School, and that is from 10 a.m. to 1 p.m. And we will continue to have that testing schedule for flu vaccine that will be ongoing through November. So recently, we updated our Safer at Home order to allow for limited private gatherings in line with guidance from the state of California. From the data collected from those who test positive for COVID-19, we know that people are gathering at private residences. Therefore, this update allows us to provide guidance on how households can reduce the risk of transmission and have measures in place to address a potential outbreak. This is particularly relevant as we head into the holiday season. Again, every individual must weigh the risks of this. Those who are at high risk for serious illness or death from COVID-19 absolutely should not be attending gatherings. So we're asking people this year to be creative and flexible with how they celebrate Halloween, Dia de los Muertos, and other fall holidays. Obviously, large events and festivals will not be permitted in the city, but we're also recommending against regular trick-or-treating and trunk-or-treating, as we anticipate it will be difficult to avoid mixing households in these environments. So in lieu of those things, we're asking people to consider hosting an online party, car parade, or trying to figure out how to do something maybe virtually in order to avoid gathering. If a person or family does choose to host or attend a private gathering, there are some requirements that are still in place. You can read about those in the latest Safer at Home order. But overall, they limit the riskiness of the gatherings by limiting the size of the gathering to no more than 3 households, maintaining consistency of the households interacting. So in other words, only gathering with the same households rather than gathering with different groups of households. Still requiring face coverings when gathering within those settings, hosting gatherings outdoors only, maintaining at least 6 feet of space between household members, and limiting the duration of the gathering to less than 2 hours. Additional ways to minimize the risk of gatherings are to limit the number of people at the gathering, since the fewer people gathering, the safer everyone is, and take extra precautions when there is singing, chanting, or shouting, including maintaining a physical distance of 6 feet or more and always wearing a face covering. So however you choose to celebrate, please remember to always avoid close contact with those who don't live with you, and wear a face covering anytime it may be difficult to maintain a safe space. Please wash your hands frequently, and also please wash frequently touched surfaces, and stay home if you or anyone you live with is sick or may have been exposed. And for additional information on the Halloween guidelines, you can, and also the updated health order, you can look that up at www.longbeach.gov/COVID-19. So I know we've been at this a long time, but we are definitely encouraged by a lot of the data that we looked at today. We are right now feeling very steady, and hopefully that will continue. We won't see some of these surges that people have been talking about on the news and anticipating these winter surges like we did in the summer. So we're very hopeful that that doesn't happen and that we can get through the season without seeing that those increases. We know that there are other places around the country that are seeing those surges already in cases, and because we don't want to experience that here in Long Beach, we just need to really kind of make the sacrifice and work really hard to limit the spread of this virus. So I know, as somebody who loves Halloween, it's kind of a big ask, but or a big sacrifice, but we really just need to do our best to limit our gatherings and stay safe.
Thank you, Sandy. There are no media questions today, so we'll get into Spanish interpretation.
Muy buenas tardes y gracias por acompañarnos para nuestro comunicado de prensa para hoy, jueves 22 de octubre de 2020. Hasta la fecha, 12,870 residentes han dado positivo por COVID-19 y tristemente hemos perdido un total de 255 residentes de la ciudad de Long Beach a COVID-19. Como usted sabe, de acuerdo con el Plan para una Economía Más Segura del Estado, que se utiliza para determinar las operaciones y rastrear estas tendencias de COVID-19, el movimiento del condado se determina basado en 3 criterios claves. La primera es la tasa de casos, segunda, tasas de positividad de las pruebas, y la última es la métrica de equidad en salud en la ciudad o en el condado. La primera imagen que se mostró enseña estos 2 indicadores que en esta semana en el condado de Los Ángeles, también incluyendo la ciudad de Long Beach y Pasadena, permanecen en el nivel morado, lo que indica un riesgo generalizado de transmisión. La tasa diaria ajustada de estos casos es de 7.6 por cada 100,000 y la tasa de positividad es del 3.4%. La positividad de las pruebas en las áreas de menores recursos, o sea, la métrica de equidad en salud está del 5.9%. Acuérdense que están tomando también medidas en aquellas áreas que se consideran de menores recursos. La tasa de positividad del condado nos coloca en el nivel naranja y la tasa de casos está en el nivel morado. Y como he mencionado anteriormente, si estos 2 indicadores caen en niveles diferentes, se aplica el nivel más restrictivo, por lo cual estamos en el nivel morado. El martes, el Estado anunció que se va a permitir operar a sectores comerciales adicionales dentro de este nivel morado, y estos incluyen locales de tatuajes y servicios de cuidado personal. Nuestro Departamento de Salud está trabajando con esta nueva información para emitir una nueva orden de salud actualizada. La imagen número 2 mostró la tasa de casos de Long Beach y el condado de Los Ángeles cada semana desde el 1 de agosto, semana a semana. Aunque el índice de casos del condado y de la ciudad han disminuido desde donde estábamos en agosto, todavía no hemos obtenido este número por debajo de 7, que es lo que se requiere para poder bajar a el siguiente nivel anaranjado. Tenemos que estar ahí por lo menos 2 semanas para poder calificar a mover al próximo nivel. Actualmente la tasa de casos está del 7.6 para Long Beach y para todo el condado. Recordemos que tenemos que estar debajo de 7. Imagen número 3 mostró la tasa de positividad diaria de Long Beach y el condado de Los Ángeles para cada semana desde el 31 de agosto. La tasa de positividad del condado es del 3.4%. Long Beach lo está haciendo un poco mejor. Nuestra positividad en las pruebas es del 2.9%. Sin embargo, como hemos compartido, la ubicación del nivel se basa en el indicador del nivel superior, por lo cual, debido a la tasa de casos del condado, el cual mencioné era el 7.6, nos mantenemos en el nivel morado. Ahora quiero compartir una actualización sobre los datos más recientes disponibles que incluye hospitalizaciones y muertes aquí en la ciudad. Como recordatorio, toda esta información está disponible en nuestro sitio de web en la página longbeach.gov/COVID-19. Imagen número 4 que fue mostrada nos enseñó los nuevos casos por fecha de episodio para nuestra ciudad. Los casos nuevos han seguido disminuyendo de manera constante desde finales de julio y principios de agosto. Esta es una dirección en la que queremos seguir moviéndonos. Imagen número 5 mostró los casos por cada 100,000. Nosotros estábamos representados por la línea azul clara y continuamos por debajo del condado y también de la ciudad de Los Ángeles, pero un poco por encima de los números totales del estado. Imagen número 6 mostró hospitalizaciones y se enseña que se han estabilizado y son más bajas que la tasa del condado por cada 100,000, lo cual es otra buena señal aquí para la ciudad de Long Beach. Imagen número 7 mostró las hospitalizaciones durante los últimos 60 días, que también han bajado. Las hospitalizaciones se informan diariamente, pero como he mencionado anteriormente, esos números pueden cambiar un poco, ya que llega información de otros condados o otros estados. Nosotros contamos los números de hospitalizaciones por residente. Entonces, si el residente es hospitalizado en San Diego, de todos modos, cuando llega esta información, cuenta como un residente hospitalizado. Las hospitalizaciones son un indicador de cuántas personas están experimentando enfermedades más graves causadas por coronavirus o COVID-19. Estamos viendo menos residentes con enfermedades graves y que requieren hospitalización porque los que dan positivos han sido más jóvenes durante estos últimos meses. En mayo, la edad promedia de los infectados era de 46 años de edad. Y ahora, en este mes, la edad promedia es de 33 años de edad. Entonces, definitivamente, la edad de las personas que se están infectando ha bajado bastante. Sin embargo, todavía hay personas que padecen enfermedades graves, por lo que debemos permanecer atentos para proteger a los residentes que están en alto riesgo, nuestros abuelos, quizás un vecino de mayor edad. La imagen número 8 muestra las muertes por cada 100,000 personas y esta imagen muestra las muertes acumuladas por COVID-19. En esta imagen, Long Beach es la línea azul clara, el estado es la línea azul oscura y la línea amarilla es el condado de Los Ángeles. La imagen mostró que nuestro número de muertes por cada 100,000 personas es 51 personas. Seguimos viendo vidas que se pierden cada semana y este es un recordatorio de que COVID-19 todavía impacta a familias, amigos y nuestros seres queridos. Imagen número 9 da la información del hospital del área aquí de Long Beach, incluyendo información sobre las camillas, ventiladores, etc. Seguimos teniendo una capacidad hospitalaria adecuada y estable. Nuestro uso de camillas es del 63% y tenemos 333 camas adicionales disponibles. Algo de lo cual quiero mencionar, quizás ustedes en casa vayan a pensar que el 63% de camillas en uso es un poco alto o más alto de lo que hemos visto, pero tomen en cuenta que muchas de las cirugías que quizás estaban con fecha para marzo, abril, mayo, junio, todo nuestro verano, fueron canceladas y ahora están pasando por todos los servicios que normalmente un hospital ofrece. Entonces, el 63% no son todos pacientes de COVID, sino también otros servicios que el hospital normalmente ofrece. También seguimos teniendo suficientes habitaciones y ventiladores para pacientes con enfermedades graves que necesitan el apoyo adicional de la hospitalización. La utilización de ventiladores ahorita es del 44%. Vamos a hablar ahorita sobre el inventario de equipo de protección personal que tenemos ahorita en bodega y también que hemos distribuido desde marzo de este año. Nuestro inventario de equipo de protección personal incluye artículos como mascarillas N95, mascarillas quirúrgicas y batas para profesionales de la salud, mascarillas cosidas y desinfectante, entre otras cosas. Tenemos más de 1,5 millones de unidades de equipo de protección personal en inventario y hemos distribuido casi 1 millón de esas unidades de PPE. Continuamos ofreciendo el PPE a nuestros socorristas, personal médico y trabajadores esenciales. Hoy nos acompañó Sandy Widgeworth, directora de manejo de emergencias de salud pública del Departamento de Salud. Ella informó que se ha realizado más de 254,000 pruebas de COVID-19 en la ciudad desde marzo de este año que empezó la pandemia. La imagen número 10 que ella mostró enseña los exámenes diarios de COVID-19 para esas pruebas desde marzo. Este mes observamos un ligero aumento en cantidad de pruebas en comparación con septiembre. Continuamos haciendo que las pruebas sean accesibles y encontraremos nuevas formas de hacer esas llegar a quienes lo necesiten. Pueden encontrar información sobre las pruebas en la página de web de COVID-19 de la ciudad en longbeach.gov/COVID-19. Como recordatorio, durante las próximas semanas también estaremos ofreciendo vacunas contra la gripe los jueves por la tarde en el Estadio Veteranos de 3 a 6 de la tarde y los sábados por la mañana en Cabrillo High School de 10 de la mañana a 1 de la tarde. Recientemente actualizamos nuestra orden de salud para permitir reuniones privadas limitadas. La clave es limitadas, de acuerdo con la guía del Estado de California. A partir de los datos recopilados de quienes dan positivos, entonces estamos agarrando información de aquellas personas que sí salen positivos de dónde han estado y sabemos que las personas que se están reuniendo en residencias privadas. Por lo tanto, esta actualización nos permite brindar información sobre cómo los hogares pueden reducir el riesgo de transmisión y tener medidas para abordar un posible brote. Esto en la particular es relevante a medida que nos acerquemos más y más a la temporada navideña. Nuevamente, cada individuo debe de medir sus riesgos. Para aquellas personas que están enfermas, enfermizas, son más débiles, deberían definitivamente de no juntarse en esas reuniones. Aquellos que están en alto riesgo de enfermedad grave o muerte por COVID-19 no deben asistir a las reuniones. Pedimos a las personas que sean creativas y flexibles con la forma en la cual celebran Halloween, el Día de los Muertos y otras festividades de otoño de este año. Obviamente no se permiten grandes eventos ni festivales, pero también recomendamos que no se realice el trick or treat, la búsqueda de dulces, o trunk or treat, que es donde dan los dulces por los vehículos, ya que anticipamos que será difícil evitar mezclar hogares con estos eventos. Por favor, considere organizar una fiesta por internet o un desfile de automóviles. Si una persona o familia elige ser anfitrión o asistir a una reunión privada, todavía existen algunos requisitos. Puede leer más en detalle sobre estos órdenes en esa página de web que acabo de dar, pero sí voy a hablar un poco sobre los requisitos. Por favor, limite el riesgo de la reunión haciendo lo siguiente. Pedimos que por favor limite el tamaño de la reunión a no más de 3 hogares y reunirse solo con los mismos hogares en lugar de reunirse con diferentes grupos de hogares. Entonces, si tiene familiares más cercanos, sus hermanos, hermanas, un compadre, por favor, pedimos que se mantengan con esos mismos 3 hogares y no esté cambiando la gente con quien se está usted reuniendo. Pero por supuesto se requiere las cubrimientas faciales y organizar reuniones solo al aire libre, por decir atrás, si va a tener una carne asada, por ejemplo, y mantener al menos 6 pies de espacio entre los miembros del hogar. Y estamos pidiendo que también limite la duración de la reunión a 2 horas. Formas adicionales de minimizar los riesgos de reuniones son limitar el número de personas en la reunión, ya que cuantas menos personas se reúnen, más seguros están todos. Tome precauciones adicionales cuando haya cantos o gritos, incluyendo mantener una distancia física de 6 pies o más. Para aquellas personas que están viendo los deportes ahorita por televisión, sabemos que muchos de ellos quizás estén gritando. Por favor, use ese tapaboca. Como usted decida celebrar, por favor, evite el contacto cercano con personas con quien usted no vive y, por supuesto, usando la cubierta facial, lavándose la mano y desinfectando esas áreas de alto contacto. Por favor, también quédese en casa si usted o alguien con quien vive está enfermo o puede haber sido expuesto. Puede encontrar las pautas de Halloween y la orden de salud actualizada con información sobre reuniones en la página de web. De nuevo, es longbeach.gov/COVID-19. Sabemos que es mucho tiempo lo que hemos estado pidiendo que ustedes sigan esto, pero sí hemos visto mejoramientos durante estos últimos meses y pedimos que todavía sigan esa orden más seguro en casa. Gracias por acompañarnos. Esto es todo por hoy. We thank you for joining us. That is all for today.